working with our individuals, we're never just working with an older adult, right? We're working with an older adult who's positioned in a really intersectional way with a lot of other aspects of who they are and what's important to them and what shaped both the strengths and the limitations that they have. So we're just giving credence to that. And the main thing that we want to be thinking about in aging isn't increased psychological risk or psychosocial risks of loss. That's oftentimes the first thing that mental health clinicians go to, but just thinking about the increased biological medical risks. So we have here a pretty big laundry list of things that we know are age associated. So we have some changes in vascular inflammatory risk, neuroanatomy, where things are changing that are age related. We have increases in a number of chronic illnesses. We have certainly age associated neurocare physician. Wait lists for neurologists can be really, really long. So a geriatrician, so an MD who specializes in working with older adults and who's board certified in geriatrics, sometimes it can be a lot easier to get in for a geriatrician than for a neurologist if the primary care physician just isn't particularly strong in this area. So I'm going to make some recommendations for screening and treatment planning, and then we're going to take a 10-minute break. I think we're going to take our 10-minute break in about 10 minutes, so at the top of the hour, okay? So I'm going to walk through a couple of assessments related to cognitive concerns, depression, alcohol use. We have these in our clinician guide, but all these that I'm providing are in the public domain. They're searchable on the internet, and a couple of these are referred to with links in that care toolkit that's a Medicare Wellness Visit. And then, in our workbook, and it's really easy to help a client kind of like develop their own version of this, is here's like the sample preparing for a healthcare visit that's focused, that includes discussions of brain health. And that's like, writing down, making sure that if I'm receiving mental health services, making sure that my primary provider knows that I'm in therapy for depression, because guess what? Depression can also be due to undiagnosed early stage pancreatic cancer or thyroid concerns or a host of other things. So medical providers need to know about mental health concerns because of this close mental health, physical health, brain health connections. And so we encourage people to think about, like, so what do I want to tell my doctor about my brain health compared to other people my age? Would I say my memory is better, worse than other? Part of cognitive activity that's really related to maintaining brain health and preventing dementia is in the area of something that's a high challenge, something new. So that means a different type of puzzle every day, including the ones that you don't like, and including the ones that you don't know how to do, that you've got to figure out how to do, and swapping it out so that learning a new language, using a new word every day, new hobby. But usually for all of these, we're really embedding it into enjoyability, which then it gets at that reducing depression, increasing engagement in interesting activities across the day, and that we're going to have a brain health boost the extent to which somebody's engaged in daily life and finding life interesting. And then here's just another example of